Hi guys, this lecture is on bone structure, and your essential question is, how does the structure of long bones enable them to carry out their functions? And you should be able to answer that question using these vocabulary. First, we'll identify the functions of bones, and then we'll discuss how the gross anatomy and the microscopic anatomy of long bones enable those functions. Along the way, we'll also briefly discuss bone markings. So the functions of bones, they support the body, and they also allow the body to move because they are attached to your skeletal muscles. They protect your soft organs, and in particular, I'm talking about the rib cage and the skull, which protect your, heart and lungs and your brain. They store minerals and fats. In particular, they store calcium. And the bones are where blood cells form through a process called hematopoiesis. Before we get into the meat of this, just take 30 seconds or so, pause the video, and see if there are any parts of the bone structure that you can identify. And when you're ready, you can unpause the video. So I'll be giving you the answers later on in this lesson as well, of course. But let's start with the gross anatomy of long bones. So there are four main parts. There's the diaphysis. There are the epiphyses. You have the proximal epiphysis here. So if this was the femur, then the proximal epiphysis is where this would be attached to the hip. And then there's also the distal epiphysis, which is where it's attached to the point that's farther away from the torso. So in this case, if this was the femur, this would be attached to the tibia. There's also the epiphyseal plate, and as you grow up, that plate becomes an epiphyseal line. And then last of all, there's articular cartilage here on each of the epiphyses, also down here, that cushion at the joints. So let's start with the diaphysis. The diaphysis has this shaft that's composed mostly of compact bone. And the outer covering, which you see right here, is called the periosteum. So if we zoom in, here you can see the periosteum is this fibrous connective tissue that covers the outside of the diaphysis and protects it. And it's secured to the underlying bone with these fibers that are called perforating fibers. They're also called Sharpie's fibers. Now, if you also cut away into the bone, you see that there's this cavity here that's filled with bone marrow. So here you can see if we cut straight down the middle of the bone, we expose that inner cavity. It's called the medullary cavity. And then if we zoom in, we can see that bone marrow. And in infants, the bone marrow is mostly red marrow, which forms red blood cells and white blood cells. And so it looks red because it's forming blood cells. And as you grow up, the red marrow gets replaced more and more by yellow marrow, which basically stores fat. If you come from a culture that eats bones, like I do, so in my culture, I'm Korean, and we make this bone soup that's so delicious. But basically, you take these ox bones and you boil them for hours and hours and hours. And the yellow bone marrow leaches out of the bones, and so does some of the cartilage. It gelatinizes the broth, and so you get this like milky, fatty broth that's so delicious. And so if you have a culture where you do that kind of thing, that's why bones make such amazing soup. Okay, and then last of all, you have the arteries. And so, oopsie. We'll talk about the arteries in a second. While we're on the topic of bone marrow, though, so you should know that if you have cancer of the cells that are in your bone marrow, then that's called leukemia. And there are different types of leukemia, but ultimately what they do is they result in malformed white blood cells that are unable to fight infection. So how do you diagnose it? You would have to, doctors would have to drill into your bone through the compact bone to get to the bone marrow so that they can take a sample and assess whether you have leukemia. And the reason why is because remember that the bone marrow deep in your long bones, and other bones, but they are the ones that produce the blood cells. So they produce red blood cells, which carry nutrients through all parts of your body. They produce white blood cells, which fight infection. They produce platelets as well, which help with clotting. And if you have leukemia, then you're going to not be able to form fully functional blood cells. So you'll have a lower count of normal blood cells and a higher count of malformed blood cells. And when your white blood cells are malformed, you can't fight infections off. And so you fall prey to opportunistic secondary diseases like pneumonia, for example. What are the causes? Well, for sure, if there are probably genetic causes, and then on top of that, risk factors like smoking or exposure to chemicals or radiation over time, like, for example, possibly asbestos. If you live in an older house, those can be risk factors that can lead to leukemia. How do we treat it? Well, you can do chemotherapy, you can do radiation treatment, but the treatment that offers the most promise for a longer lifespan and a normal life is stem cell or bone marrow transplant. And that's because in adults, you have very, very few sites in your body that still have stem cells, and they're mostly in your bone marrow. This is a very risky procedure, however, for both the patient and for the donor. If you can find someone to donate bone marrow, and that's already really difficult to do. I actually have a friend who was asking for a friend of hers, are any of us willing to donate blood marrow, and can we join the blood marrow registry? Bone marrow, I should say. And the reason is most of the people who are on the registry to donate bone marrow tend to be Caucasian, which means that if you are a leukemia patient who is someone of color, a lot of the people who are on the donor registry are less likely to be the right match for you. Like their blood cells won't match yours. And so if you are a person of color, I do want you to consider registering for the bone marrow donor registry. It's called the Be the Match registry. Maybe not now, maybe in a year or two when you become adults, but that is something that could potentially save the life of someone else. Moving on, so we talked about, for the diaphysis, we talked about how it's the shaft of the bone and it's made of compact bone. It's surrounded by the periosteum, which you can see here. It's got marrow in the medullary cavity, and then last of all, it has these arteries, which you can see here, and they penetrate into the bone itself so that they can deliver nutrients to the bone. They can take away newly formed blood cells from red bone marrow, and then they can also take away waste. Okay, next are the epiphyses. So you have your proximal epiphysis, you have your distal epiphysis. So these are the ends of the bone, and they're composed mostly of spongy bone. You can see the difference here. So the spongy bone tissue looks spongy, and the compact bone tissue, which you'll find in the diaphysis, looks a lot more solid. And the epiphysis also contains red bone marrow, or red marrow for blood cell formation. Next, you have the epiphyseal plate, or the epiphyseal line. So this is the area where the bones actually grow and get longer and longer, or ossify. When you're younger, part of this region is filled with cartilage, and then as you get older, that cartilage gets replaced by bone, by compact bone. So the older you get, the smaller the epiphyseal line gets, until eventually you become a full-grown adult. Here is a picture of that in an x-ray, so you can see this is an epiphyseal plate that is closing up. And so this person still has some growing to do, but eventually that will close into a fused line. Next is the articular cartilage, and so you'll see that covering the bones on each of the epiphyseal ends. And they're made of a special type of cartilage that basically decreases the friction at joint surfaces. So if your cartilage wears down, then that will cause your bones to grind against each other. And when that happens, that causes a lot of pain, and it's called arthritis. And we'll talk more about arthritis in a future lecture. Okay, so take a few seconds. See if you can identify all of the leader lines on this image, and then when you're ready, you can unpause and I'll go through it with you. All right, so let's start with, you've got the proximal epiphysis and the distal epiphysis down here. And here, the proximal epiphysis is made of spongy bone, and it's covered in articular cartilage right here. And it meets the shaft at, or the diaphysis, at what is called the epiphyseal plate in younger kids and an epiphyseal line in adults. Here you have the diaphysis, and the diaphysis is made mostly of compact bone, and it's covered in the periosteum. Inside is the medullary cavity, which is filled with bone marrow. And if we zoom in, we can see, once again, here's the medullary cavity. There's an endosteum that's, lining the inside. Here's the yellow bone marrow in this particular case. Here's the compact bone. Here is that periosteum again that is connected to the bone by Sharpie fibers or perforating fibers. Here are the nutrient arteries. Then over here, we're zooming into part of the epiphysis, and we can see there's compact bone and there's also spongy bone. And then once again, we've got the cartilage surrounding it. We're going to just briefly talk about how bone surfaces are not completely smooth and uniform. They have these little nubs and crests and heads and dips and divots. And so there are different lines for all of these different markings. For my class, you don't need to memorize the names of these, but what you do need to recognize is that these bone markings tell us about what type of bone it is, what other bones it articulates with or comes together with. It gives information about wear and tear, and so on and so on. And so basically, just when you think of bone markings, just recognize that bones do not have smooth surfaces. And all of these different surface features tell you about how the bones are attached to different things. There are different categories. Some are projections, which means they grow out from the bone surface. Others are depressions, which means they're dense in the bone surface. Let's get into the microscopic anatomy of compact bone now. So we're talking about the compact bone that you'll see in both the epiphyses and the diaphysis, but especially in the diaphysis. So here you have a long bone. We're just going to zoom in on a piece from the end of the diaphysis, from the surface of it actually, and this is what you would see. So you can see over here is the periosteum with the perforating fibers. Over here is the a little bit of spongy bone, and then eventually you'd hit the medullary cavity. But this part here, the compact bone, we're going to identify like what is its structure made of. So let's start with when I think of the structure of compact bone, I think of Swiss rolls that have raisins in them. So you can see you've got this cake. Like here's the wedding cake. We've got lots and lots and lots of Swiss rolls that have been arranged together in these concentric circles. So just think of like this whole cake would kind of be like the cross section of one of your long bones. And then it would be made of these individual Swiss rolls that have this like rolled up cake with these little raisins stuck in all of the layers. So hopefully that analogy will kind of make sense to you. But let's start with what is the compact bone composed of? Well, it's made of osteons, also known as Haversian systems. So this word osteon and this word Haversian system are synonymous. It means it's a unit of compact bone, and it's composed of these things. And then in addition, we see perforating or Volkmann's canals. So I'll talk about each of those in turn. Let's start with the lamella. So what we have here is one osteon, here's another osteon, here's another osteon, back here is another one. And if we just zoomed in on one section of one osteon, so imagine that I took like a slice of this Swiss roll right here and zoomed in on it, this is what I would see. So this is one of those osteons that make up the compact bone. And first of all, you'll notice that it's got these layers. Each layer or each ring is called a lamella. So concentric rings of hard bony matrix. Now, sandwiched in between the lamella are the lacuna. So we have one lamella, another lamella, another lamella, another lamella right here. But then in between each of those four lamella are these pockets of space called lacuna. And so we have 1, 2, 3, 4, 5, 6, 7, 8 lacuna. Lacuna are cavities that are in between the lamella, and they contain bone cells called osteocytes. Now the bone cells here, right here and right here, are like the living cells that live inside the lacuna. So the lacuna is the room, and the osteocyte is the occupant of the room. And the osteocytes do have to be able to survive. So here you can see, here's the osteocyte, it would be this dark purple thing. Here's the lacuna, so that would be the empty space around it. And you would find this in the spicule of bone here. So this looks like it's maybe spongy bone. And there are additional cells out here. But this is what you would find in one of these osteons, right? So like just, you have these little osteocytes, like little raisins stuck in there, and they occupy those lacuna. Okay, so next, you know that these are living cells, and in order for them to survive, they have to be able to receive nutrients and get rid of waste. And so for that reason, you have these little roads, these little canals called canaliculi. Canaliculi meaning tiny canals, that form a transport system for the osteocytes. So here's a canaliculus, here's a canaliculus, here's a canaliculus. So all these little spider-like projections through the bone matrix, those are canaliculi. Here's a canaliculus. And those canaliculi allow blood that's coming in through these central canals to spread out through each of the lamella to then feed the osteocytes in each lacuna in this osteon. Okay, so you'll notice that each Swiss roll or each osteon does have a cavity in the center, and that's called the central canal. And it's full, it has these blood vessels and these nerves. So the blood vessels are shown in yellow, red and blue, and the nerves are shown in yellow here. And they run up and down the entire osteon, feeding all of the osteocytes by just letting blood seep through the little canaliculi. But in addition to that, you also have these perforating canals, also called Volkmann's canals, that run perpendicular to the central canal. And what they do is they actually connect across between osteons, and they carry blood vessels and nerves, and they connect back to the more major blood vessels that are found in the medullary cavity. Here you can see a model of the bone. So here would be the medullary cavity, here would be the periosteum, and there are multiple osteons made of multiple lamella, those rings that make up each osteon. In between, you see those little dots. So these tiny little dots between those rings are the lacuna, and in each lacuna, you would potentially find living osteocytes. And then remember that at the center of every osteon, you're going to have a haversian canal that will bring blood and nerve, instructions. Okay, so remember that the functions of bones were they support the body, they protect soft organs and allow for movement, they store minerals and fats like calcium, and they form blood cells. If you can pause the video and just in your own mind think about how are the bones able to do these functions? And if you can connect these specific functions to the specific structures of the bones that enable them, then that means you have mastered this topic. And when you're ready, you can move on. Okay, I know this is a horrifying picture to look at. What's happening here is bones get their strength from the calcium that's stored in the bony matrix. And so the more calcium that you store in the bony matrix of, like the lamella of the osteons, the harder the bone is, the denser and stronger it is. However, if you can't store calcium in your bony matrix, your bones soften. And if they soften, then that can lead to fractures and deformity. This is a very common childhood disease in many developing countries, and the reason for that is they may have a vitamin D deficiency, either because they may not receive enough natural sunlight, because sunlight stimulates your skin to produce vitamin D, or they could have a congenital defect that they're born with that prevents them from being able to produce vitamin D. Alternatively, it might be like maybe they do have adequate sun exposure, but maybe they are not able to get enough calcium because they're malnourished. They don't have access to calcium-rich foods like dark green vegetables or milk, things like that. In the United States and other Western countries, a lot of whole milk is vitamin D fortified. So if you go to the market and you look at their whole milk, it will say with vitamin D. And the reason is when parents are weaning children off of breast milk, they're switching them to cow's milk, and they always start with whole milk. And so by feeding these children whole milk that's fortified with vitamin D, you're ensuring that your children will not get rickets. Here you can see this is an x-ray of someone with rickets. And so because their bones have softened, there are multiple tiny fractures that are happening that are causing the bone to form this bow shape, which means that these children will not be able to walk. And here you can see that again, multiple tiny fractures, because the bone itself is not dense and hard the way that you would find in a normal bone because of the inability to store calcium. Okay, so here's the microscopic anatomy of compact bone again. Feel free to pause the video and just study it. And when you're ready, let's get to our takeaways. In a later lecture, we'll talk more about bone growth at epiphyseal lines. We'll talk about bone cells. We'll talk about how bones change shape. But that's not going to be part of this lecture because it would make this lecture too long. Here are your key takeaways. First, you should know that long bones have a diaphysis made of compact bone, where the inside is going to have bone marrow in the medullary cavity that stores fats or that can make blood cells. And if you have leukemia, that would impact your ability to make blood cells. Long bones also have epiphyses that are made of both spongy and compact bone, and they can grow at the epiphyseal plates, and they have articular cartilage on the ends that cushion your bones at the joints. Compact bone, which you'll find at both the diaphysis and the epiphysis, but especially the diaphysis. So compact bone is made of osteons that store minerals like calcium, and they also house living osteocytes, so living bone cells. And compact bone also has blood vessels that exchange nutrients and waste with bone cells. But if you have poor nutrition, that can cause your bones to soften and deform. Okay, I'd like you guys to go back to the beginning of this lecture and take a look at the essential question again and see if you can answer the essential question using the vocabulary that was on the right-hand side. Man, this is a lot of slides. Okay, here you go. So I hope this was helpful, and see if you can answer this question using all of these vocabulary.